Hello, everyone. For our country profile project, we have Saudi Arabia, and this is part two. Nutrition and public health. According to the World Health Organization in Global Nutritional Health, about 40% of females who are in the pregnancy age or who are pregnant shown to be anemic. Where in the diabetes category, there has been a big increase amongst males being diagnosed with diabetes, growing from 17.5%. I believe the last time it was recorded was around 2005. Um, However, in clinical obesity, females showed to be about 40%, where males are 30%, those who are recorded. Now, that all ties with their nutritional lifestyle. Um, Saudi families usually that are up there in the socioeconomic status, they have access to these fast food chains and can consume these Western food diets, and that's what's happening right now is that they're adopting the Western food diet. So eating a lot of fried food, foods that are basically high in energy and fats. Um, Now, aside from that, the rural area of Saudi Arabia or population, I believe they're defined as the Bedouins. I apologize if I pronounced that wrong, but their diet consists of the typical Mediterranean diet um, that are usually from the Levantine area as well. Chicken, beans, rice, um, other sources of proteins. Now, the chart on the right shows your typical Saudi Arabian family uh, diet consumption. You can see that a majority of that is carbohydrates, and a lot of their protein comes from animal sources. Um, Now, you can see that being tied into why um, why there's a big increase in women who are anemic, an increase in males being diabetic, and such a high percentage of people who are clinically obese, because it is shown that there is a fewer consumption of micronutrients as well as fiber. Um, Now that also ties in with their lifestyle, having access to those kinds of Western foods and fast food chains. So overall, um, according to these statistics, um, there should be some sort of nutritional education or intervention for a lot of Saudi Arabian families.
We're going to be talking about non-communicable diseases in Saudi Arabia. So Saudi Arabia is a high-income country, so with that increasing life expectancy, we do see that non-communicable diseases are becoming more prevalent. High tobacco smoking is one of the interesting ones that I found in research. So that's typically very high in males. It's not as common in females. And overall, there's a 16.4% probability of dying from a non-communicable disease between ages of 30 and 70. So over to the right shows a graph of mortality and how that's distributed among different non-communicable diseases. So you can see that cardiovascular accounts for a large proportion of those. Looking more specifically into some of the determinants of these diseases, so we have age, which they are more prevalent among older adults, gender, employment and marital status, and smoking, which we did mention is much more common in males. Overall, these chronic diseases are higher among males, except for depression and anxiety disorders. In the table on the right, we see the distributions of some of those different chronic conditions. Some of the actions needed in Saudi Arabia to better manage these with their increasing prevalence. Prevention is obviously a huge tactic. Some of the interesting ways that I found to improve are to improve screening at the primary care level. And in order to incentivize citizens taking advantage of primary care, it's providing an insurance plan with those screenings. So I really enjoyed the graph at the bottom as well. It's showing number of deaths split between males and females. So again, we see that the non-communicable diseases are much more prevalent in males. We see that cardiovascular diseases accounts for a large proportion of that.
There's also a significant burden of communicable diseases in Saudi Arabia, although it should be noted that the burden of communicable disease is much lower than that of non communicable diseases. Also, many communicable diseases have been in dramatic decline in recent decades. For example, hepatitis C used to be very prevalent, with a prevalence of about 39% in children back in 1989, which was not really that long ago. And yet, as of 2008, it was just 5%. Also, lower respiratory infections are the most prevalent communicable disease in the Kingdom of Saudi Arabia today, with over 15% prevalence, and it's the fifth highest cause of death in Saudi Arabia. Some determinants of health with regard to communicable diseases. In general, individuals born at a low birth weight who reside in crowded homes, who are habitually exposed to air pollutants, or who are HIV positive are all positive determinants of communicable diseases. So at first glance, a lot of these might not apply to Saudi Arabia because they have a total fertility rate of just 2.4, they have low HIV prevalence. So a lot of these categories seem like they shouldn't be a huge issue, which brings into play wealth disparity because people of a lower income bracket tend to have more children. They tend to live in smaller homes. There you get more crowded homes, less access to all kinds of birth control, of course, and other means of preventing large families and STDs, as well as other viral and bacterial transmission. And definitely worth noting is that particulate matter 2.5 in many places in Saudi Arabia is actually double the World Health Organization recommendation for safe air quality. And this is largely due to private vehicle emissions on the road. And so actions needed, a huge one is reducing these emissions from fossil fuels, because especially for that lower respiratory infection issue, those emissions are causing huge issues in the area. And also, they have done great things with the vaccination program for hepatitis B. It's very much in decline in Saudi Arabia, and they should continue that vaccination program, and any other diseases that can be vaccinated should be.
Saudi Arabia is dealing with several environmental factors, one of which is air pollution. The World Health Organization defines the air quality in Saudi Arabia as unsafe, with their annual concentration being far above the recommended maximum. The largest contributors are vehicle emissions, industry emissions, and dust storms, with dust storms actually exacerbating the issues based on the season. In the spring, the dust storms are particularly bad, reducing visibility, increasing traffic and accidents, and heightening respiratory diseases. They can actually also contain carcinogenic elements, so these are really poor elements to affect the air quality in Saudi Arabia. In addition, global emissions are another factor that they are dealing with, ranking 11th in the world for total carbon dioxide emissions, primarily from natural gas flares and fossil fuel emissions. So their water is another factor that they are dealing with. They are actually undergoing a water crisis, suffering from water availability and water quality. Here you can see a graphic displaying just how disproportionate their water availability is compared to the world average. This comes from mismanagement of agricultural practices and a transition to a different consumer-based lifestyle. Having no permanent lakes or rivers, little rainfall, and groundwater means that when they do get rain, they're at high risk for flash flooding. So all these factors mean that there is water scarcity, poor sanitation, and poor hygiene in play when they are not taking proper precautions. And then with all the factors that we are discussing today, the hardships of this strain is experienced most by those who are poor and in a disadvantaged position. Moving forward, Saudi Arabia is attempting to increase reform on emissions and creating a more sustainable development to support the environment and better their water sources.
So here are some statistics about infant and maternal health in the Kingdom of Saudi Arabia. So some major trends in the country are in the under 5 mortality rate, which is the rate of deaths among children under the age of 5. And overall, it is 6.6 deaths per 1,000 live births. And among female children, that's 6 per 1,000 live births. And among male children, that's 7 per 1,000 live births. The maternal mortality rate in Saudi Arabia is 17 deaths per 100,000 live births. And the neonatal mortality rate is 3.7 deaths per 1,000 live births. So in 2008, a study was conducted on the maternal health care given to women in Saudi Arabia, and it was found that 97% of live births in Saudi Arabia were attended by a skilled health professional, and 97% of women were attended at least once by a healthcare provider during their pregnancy. So, and in the adolescent birth rate, there were 7 births per 1,000 women from the ages of 15 to 19. And you can see on the graph the major causes of death for children under the age of 5 in Saudi Arabia. And that includes birth asphyxia, injuries, pneumonia, neonatal pneumonia and regular pneumonia, and prematurity, and some other ones, including sepsis and diarrhea.
Many of the kingdom's natural disasters have been centered around floods, while terrorist attacks have been man-made disaster. In the past, no flood preparedness plan was in place since the issue became more prevalent beginning in the 2000s, mainly because of climate change. The kingdom lacks advanced technologies that could otherwise help. I found a study that uses empirical investigative approach reported that the factors used to address disaster response before an event, like funding, people, training, and coordination, were adequate in funding but lacked in areas regarding training and people. This shows that although the government may have organizations that are financially able to help in case of a natural disaster, there aren't enough people trained to help in these situations. In the Jeddah flood of 2009 particularly, it was bad because it showed that they weren't as prepared as they planned, but revisions have been made since then, and since disasters are cyclical, training and communication have been prioritized in areas of improvement. Currently, little is known about the kingdom's disaster management because the data and research isn't disclosed by their government. Also, more recently, the leading cause of man-made mortalities have been motor vehicle accidents, which was the cause of 6,000 deaths in 2008 alone. This number is 12 times the amount of natural disaster deaths from the past 30 years. The kingdom has been working with the UN to develop an international strategy for disaster reduction, which is a global initiative to improve disaster management. Since the data is necessary to evaluate and analyze and improving disaster preparedness, we're only limited to reviewing the management rather than planning for prevention or changes. The kingdom has agreed that community awareness, resilience, and collaboration is important in managing for disasters, and they plan to adopt a framework that reduces risk, especially during Hajj, which is the religious pilgrimage that thousands of people make to Mecca, which could also bring diseases through the travelers that they need to be prepared for in case of an emergency.
Here are references used for this project. And now it's time for some discussions and questions.